Hello and welcome to Beyond the Limit. My name is Zainab Mohammed. On this episode, we'll be speaking about hearing impairment, and with me here is a lovely parent to a lovely young lady. She'll be telling us about her experience raising this young girl who has hearing impairment. Thank you so much for making time to join us on the show, Florence. I'll let you introduce yourself.
My name is Florence Wamboiwayake. I am a mother of 4 girls. The last one being the one who is hearing impaired. She's mature now. She's 33 years of age.
Wow.
But I keep saying she has achieved. She's an empowered woman. She's a professional in her own rights because she's an interior designer. She's a painter. And she does very many things, including helping children with disabilities.
Okay.
Yes.
Could you tell us, take us back to when she was born? How were you able to realize that she had hearing impairment? And then what did you do as well?
She's called Yvonne Waiderawayake. She was overdue 2 weeks, so I was put on induction drug. Unfortunately, I got overdosed with the induction drug. And in the process, I was told in the process it affected her much later. So when I gave birth to her, yes, it was almost a matter of life and death between me and her. But eventually I got the baby. And along the way, we could tell we didn't even think that there is any disability. As you know, nobody expects to have a child with disability. So we didn't expect that either. And her being the 4th born, we didn't think about it. Until when she was 8 months, we noticed that she was on her own. She doesn't want any interference with anybody. She wants to sit down somewhere alone. And she was making a funny noise all the time. So that made me get concerned. And I decided to take her to the doctor. We did take her to the doctor. And yes, she was confirmed that she has a hearing impairment. Soon after, she had an operation. They removed some fluid from her ears, fitted her with grommets. And then later, we were told we have to use hearing aids. Her hearing aid is severe, almost profound, by the way. Some doctors tell me they don't know how she hears, because once she removes her hearing aids, she can't hear at all. If she locks me outside and she doesn't have her hearing aids, I have to look for some place to stay because she won't hear. So she was, we tried different, what did we do after we realized she had, of course every mother is in denial, every parent is in denial, but as much as possible we try to deal with it. And then we realized for us to be able to help her, we need to come out of our denial so that we help her, which is what we did. We looked for all the help that we could through the specialists in the different areas. And she was fitted with her first hearing aid, maybe at 1 and some months. She would not stay with them because she would throw them away. They were not, that time, fitting of hearing aids is not like today. You would get donations and you think it's the proper hearing aids. Until time went on and we realized we had to go and to a professional to get the right hearing aids. And so the one we were recommended for, which is in the canal, we could not fit it when she was small. It has to be fitted at a certain age. So eventually when we were told we can fit her with that one, it was not available in Kenya. We had to import it from Germany at 300,000. And she was fitted with it and she's actually using it to date.
How was it like for you, a mother of 4 girls? The other 3 are okay. How was it like for you, even the acceptance and the journey and the frustrations that came with it?
I think for us, what will I say? We have always been a very close-knit family. So when we realized this is a problem which we have to deal with, we actually sat down and talked about it and decided to deal with it as a family. And because me and my husband were together in working on this issue, the other children did not have a problem. After all, some of them could not understand exactly what it was because they were also still young. But along the way, we made everybody within the family understand this is something we have to deal with. She's not different from anybody else. We are not going to pity her. She's going to be brought up like any other child, and she's going to be guided accordingly. So we'll give her the support, but we'll not pity her, which is what we did. She was never pitied. She went through the normal beatings like everybody else if she does something wrong. But she became empowered when she was quite early. At about 5 years, we realized that she was very good in art because she could draw things. And so at that early age, we started nurturing her art. So even in school, we had to highlight that to the teachers, and we had to be involved with what is happening in school. We had to talk to the teachers and explain to them her challenge. Of course, we had challenges because I think her first hearing aid was crushed by one of the kids. Just removed it, put it down, and just crashed on it. You can't do anything because he didn't know anything better. Money was still scarce when you were buying those hearing aids, because if I remember, when we bought the main one, we had to go and look for a loan to be able to buy it because the insurance companies don't cover. Maybe now they do, but before then they were not covering. So you had to bear the costs 100%. But as a family, we worked with her, we agreed to work with her, and even today we are still close-knit. We have supported her in very many ways. They support her, the others supported her. And then we highlighted her predicament with the rest of the extended family. So in the end, everybody had to understand that this is us. And because we accepted it, then there was nobody who was coming in between. So we made her life much easier because we were spearheading for her. And we are guiding other people about her disability. So even if you meet her today, she'll tell you, I'm Yvonne Wayaki, I'm hearing impaired.
In your opinion, the early intervention, what difference did it make for Yvonne's life? If she didn't get it, how would her life have turned out?
I think I look at her life and I look at the lives of other children who are in the same category, whose parents did not take the initiative of doing the early intervention. Today they are deaf, completely deaf. And why? Because if you consider that when you're wearing hearing aids, you are actually trying to rescue the residue hearing you have, just like the way we use our glasses. So we knew, and I have gone deep, done a lot of research and, done so much to just understand the hearing problem. So for me and my family, we realized that we had to start helping her. So we helped her at home. We participated in school. And then we always made sure she has somebody else who is trying to teach her what she's not able to learn. So we started our early intervention, let me call it the orthodox way. We were doing it our way. But along the way, we realized there's a better way of dealing with it. So we know, yes, we did early intervention our way. We helped the teachers do the early intervention the way they could. But of course, the speech therapy is usually very expensive. It has always been expensive. But we made sure that we committed time, money, and love to that child for her to gain the early intervention, which along the way we could see the progress. You could see how she's refining her speech. There are times when you couldn't hear some words. Now she talks. I mean, she can talk to you. She can stand in front of people and talk without fearing. So early intervention is very key, because if we had not intervened in her, what would have happened? She would have been thrown to the slow learners, or she would have been thrown to the deaf, which means she would have lost her residue hearing and residue speech.
Okay. As we wrap up, I know Yvonne's journey inspired an institution, the kind of activism that you do right now in working with children who have hearing impairment. Could you tell us a little bit about that, and then your message to parents who probably have kids right now and probably don't see the essence of early intervention, just in brief?
Okay. Through my own experience with my daughter, and through seeing what the other parents were going through, in 2015, actually I should have started this program in 2009. That's when I got the message that I should start it. But I was working, so I started it in 2015. Why did I start it? So that I can support other parents and support their children. I can sensitize the parents and I can support them any way I can. I do support them through sensitization. I do support them by connecting them with the people who will support them. I do highlight the essence of early intervention so that they can start to work with their children early. So that is why I started Ear Trek. It's called Ear Journey. It's actually, the meaning of Ear Trek is Ear Journey. The journey we walked with my daughter as a family, as an individual, the journey she has walked herself, the challenges she has found across the way, and how she has reached where she has reached today. So Ear Trek is a community-based organization. Right now we have a center at Kasarani. We are mentoring children 1 to 5 years, trying to do early intervention before they go to school. Instead of your child being with a house girl, bring the child to us and we will help your child go through. We use special trained teachers, we use speech therapists, we work with like doctors of hearing. I've been working with them for quite a while. So we are working together so that we can enrich the life of a child with a hearing impairment. The earlier the better. And so I am a support of parents, I am a support of the children. And in that organization, we also work with the older ones. The youth who are deaf, we still support them in different ways. The parents, we support them because they're caregivers and we want them to know how to deal with their children.
Your message in 1 minute.
My message to parents is that you cannot segregate or sideline your child because of a disability, whatever disability. Early intervention is key because it will help your child get the help they need early enough. If you stay long in denial, your child loses more and may not recover the way they should have recovered. So for me, every parent should check for the vital signs that their child has a problem early. And then what they should do is try to monitor the milestones, because the developmental milestones helps you identify whether your child is hearing or not. Your child is, we will have speech development issues. So we are working with that. We are working with parents to just try and see, even those ones who have delayed milestones, we are working with them to refine their speech.
Thank you so much, Florence. Let's take a short break. When we will be back, we'll be coming back with a specialist who will be telling us about the causes of hearing impairment and what to do in case you have a child with a hearing impairment.
The news that matters the most is the one that hits close to home. When disasters strike, we are there to inform you. When the bullets are flying, we tell you who's shooting and why. Reporting on your victories, your health, your money, your security, your past, present, and future. We are interested in telling the stories of creativity, hard work, and resilience that you are known for. That is our job. This is my job. My name is Victor Muyakane, and it's my honor to bring you this news this way every Thursday night on the Home of Untold Stories.
Katika majengo haya, hapa ndipo sheria zinapotungwa na zinapopakuliwa.
Hearing impairment, the causes and why early intervention is very key. Dr. Richard, thank you so much for making time. We were speaking with Florence earlier on and she was telling us about how she was able to salvage the life of her daughter by going for early intervention. So tell us, before we go to early intervention, what are some of the causes of hearing impairment and what are some of the ways or interventions that can be done to salvage the hearing residue that is there?
There's so many causes of hearing impairment, or what we call hearing loss. Starting where somebody can be born with a problem, we say congenital hearing loss, and means this person was born with a hearing problem, and it takes time the parent to realize that there's a hearing problem. But it's also very easy to detect whether the child has got a hearing problem, because there's what you call milestones. The child will start babbling at this age, things like that. When you call the child's name, they can be able to turn, they can smile. When they hear some interesting sound, when you try to mimic their sounds, they can laugh. Simple things like mothers do or parents do to see whether the child is following simple instructions. But sometimes when you find that the child cannot even follow those instructions, even before going to the doctor, you want to think of, could be this child having a hearing problem, or can we go and see who does the hearing assessment, just something simple called hearing screening, so that you can be able to tell whether this child is hearing or not. And those people who do that kind of job, they are audiologists like myself. So other causes is that what we call acquired. You can get hearing impairment, you can get hearing loss after being born normal, and you develop speech. Because one thing I've not mentioned when I talked about congenital hearing problem is that when somebody doesn't hear, when they're born with a hearing problem, is that it takes time also to develop speech, or you might not even develop speech, what you call speech delay. Okay, so the second point of the causes of hearing impairment is where you say somebody has acquired hearing problem. And how do you acquire it? You can acquire through noise, what you call noise-induced hearing loss. You can acquire through ototoxic medication, like quinine. You can acquire it, through tragic experiences like an accident that happened and you got quite a lot of damage, and many other causes. One of the causes also be old age that doesn't have any kind of treatment for that. But the leading cause of hearing impairment nowadays is where people are exposing themselves to noise, where you find that every other person is using a device to listen maybe their favorite station or favorite music, or they're doing that they're exposing themselves to too much noise. And that, with time, it causes what you call noise-induced hearing problem. So that is preventable. And that, being a leading cause of hearing problem, can be prevented. Why don't we do so? Yeah.
Absolutely.
Yeah.
Before I ask you how do you know the safe level in terms of volume, going back to the parents, there's so many ways in which maybe you call a child and they're distracted, so they might not respond. At what point do you flag it off as this could be hearing impairment?
You see, as a parent, you do not call it hearing impairment. Some parents say, the child is on and off, hears or doesn't hear, or she hears or she doesn't hear. So at this point, it is not, they'll not, be able to say or diagnose it's a hearing impairment. They want to say, why is my child not be able to turn when I called? And maybe the peers, the age mates, even having a word or two when they're being called by their parents. Why is my child not be able even to respond to simple instructions like hi, without even looking? Because when you say hi and looking at me, it's visual. You can see that somebody is signaling you. But when you find that the child needs some attention, is that when the child doesn't develop speech, most parents, that's what they are doing when they doesn't develop speech. And speech is not like what you were talking, not a whole sentence. When the child doesn't have a word or two, or cannot even respond to the name, this is a problem. So a parent will not go straight away and say this is a hearing problem. The parent will look at signs like this child doesn't turn when I call, this child doesn't respond to their name, it doesn't even say hi when it's not facing me, things like that.
Okay.
Yeah. So those are the things that will happen in most cases in the house setting.
Okay.
Yeah.
In terms of interventions, what options are there?
Now, there are a number of interventions. What you might say is that when you look at the child, especially now I talk about the congenital hearing problem or the hearing problem that's parents are born with, is that you'd want, first of all, to have this child tested. Okay? We say the pediatrician refers them to audiologist. All we do is to test the hearing and see whether actually there's a hearing problem or not, because other things might be causing the delay of the speech delay.
Yeah.
But the first one to be checked is hearing. because if you don't hear, you don't talk. So they'll send them to us, and we do the screening. If this need be to do a diagnostic assessment, we go ahead and do that. Because hearing impairment is not at one level. You may find somebody having a mild, you may find another one having a moderate, moderately severe, or even profound cases. So we want to classify at which level so that you can look at intervention that is needed. Because hearing impairment doesn't have one solution. Yes, it can be one solution, but a very specific solution for that kind of a problem. Because if it's a child who's got a severe to profound and they have no speech at all, and they are below about 3 years, you'd like them to use a hearing aid for some months as you observe, and then if it is not benefiting the child, you send straight away to do some cochlear implant. And that's the ultimate solution for such a kind of young child. Because what happens is that they need a bit of speech therapy and then start developing speech. And then you have solved the problem once and for all. But now what you're finding is that people are delaying so much, and you find that about 5, 6, 7 years. In fact, you ever had a patient of 10 years and they have come for a solution. When it is that late, you don't have a solution for such kind of patient. And it is because they're getting this late. Not that they have not seen the signs, they have seen them, but they are listening to the meds that are associated with the hearing problem. Somebody may tell such a parent that, the uncle of this child talked when he was 10 years old. Now you're waiting until 10 years old. This magic to happen. It doesn't work like that. And some of these myths should not be followed at all, because they don't work. All you do is that you're delaying the problem, and it comes to a point that it cannot be helped. So other cases where you find that the hearing problem is not severe, it's about mild, moderate, or moderately severe. There's a usage of the hearing aids which has been very successful, and then you can introduce this child to sounds, and this child can be able to follow instructions. For instructions, can start having word, and also with the assistance of people called speech therapists who will help in developing the speech. So those are the solutions for such kind of thing.
Okay. Is treatment costly?
Depends. Now, hearing aids also, it is not one fit all. They come with different specifications. What you call channels, what you call bands, things like that. So it depends on what exactly it's needed for such a kind of a child. So, these things is that not unless you have the test, and in fact to get people calling us and ask how much is a hearing aid, the next question you ask them, has this child been done the hearing test? Or this person, the patient you're calling on behalf, or are you the one? Have you done the hearing test? Because that's more or less of, say, prescription for the hearing aid. Because we want to look at it and then give you what is available for that.
The reason why I'm asking is because Florence told us that they got a hearing aid at 300K that had to be imported. So is it something that the common Mwananchi can afford?
Yes, nowadays they are different technology, different levels of the hearing aid. Okay. So they range. I would want to believe that is the premium brand or premium level of the hearing aids. So what happens is what you call premium, the essential, the standard hearing aids. Now, why do we have that kind of classification? It's just because of the channels of the hearing aid. The channels is how much. The more the channels, the more high-tech the hearing aid. There is a channel. But what you're looking for first is that to introduce this person to some kind of sounds which they've never had. So like in our center, doctors of hearing is that we have hearing aids ranging for about 45,000 and going up, but subject to the hearing test done.
Okay. In terms of early intervention, why is this very necessary?
In terms of early intervention, now we are looking into a situation where we want to integrate this child in normal schooling. We're looking in a situation where we want this child to have normal conversation, even if they may end up learning how to sign, which is another advantage. It is for them to be integrated to the normal system, where any other person with a hearing, any other person with speech, you can be able to compete. Look, when you have seen a child who has got a hearing problem and do the intervention, This child will go to normal school, will go to normal campus, will integrate with others, will compete with others at the same level, economically and politically. I've got a couple of doctors who've got hearing aids, using hearing aids, and they're doing very well in their different specialization, because they did their undergrad, they did their masters, they're specialized in what they do, and they're doing the work that a normal person is doing. So early intervention helps us to integrate this child into the normal system. They might learn sign language, and it's an added advantage, because they even have a clientele who will use the sign language. So it is also good to have the sign language part of it, as well as they can speak as others they do.
As we wrap up, what part is technology playing in terms of increasing cases of hearing impairment, and what can people do so that they're able to use technology but also be safe? Just as we wrap up.
Now, some years back, there was no something we call newborn hearing screening. So a day-old child can be screened to see whether they have got hearing problem or not, and it's done here, because we want to see a child who has got everything. Some years back it was what's the color of the skin, did the baby cry, how was the weight of the baby, all things like that. Now what we are doing matters of hearing is that technology has allowed us, we can screen a day-old child with what we call pass or refer test. So where the child passes, we find that is good to go, everything is okay, matters hearing. But if the child fails, it doesn't mean that they have got a problem with the hearing. So this thing goes like 1, 3, 6. So you screen on 1 month. If the child fails, you repeat it, the test at 3 months. So why should a test fail the first time? Maybe the child was crying, maybe the room was noisy, or there was just a surrounding noise in the room. So the test might fail. So when you repeat at 3 months, you'd expect that the child will be calm, you prepare the mother, make the child will be naturally sleep when you're coming, feed the child so that when you start this test, because it doesn't take time, about 2 minutes, 1.5 minutes, 2 minutes, you're done the test. Now you find still they're failing the test, you repeat on 6 months. Remember I said 1, 3, 6. So you repeat it around 6 months. What you're doing now is that you want to confirm whether there's exactly a hearing problem and at what level, so that you can start the intervention. So we are saying that an intervention of a child who has got a hearing impairment can start at around 6 months. So what have you done to this child is that you have let this child be exposed to the sound like the peers. Matters development of speech will happen at the same time. So there will be no delay in any case, or the speech delay, or any what you call milestone delay. It matters hearing. So that's what technology is doing. Yeah.
Thank you so much, Dr. Richard. That's all the time we had for you this week. As you've heard from Dr. Richard, practice safe listening. I've been your host, Zainab Mohammed. Until next week, goodbye.